Welcome to the first edition of Biomimetic Study Club podcast. We're bringing together many of the concepts that have been taught over the last 15 years, making them available to as many dentists as possible. I hope that you've taken advantage of receiving the PDF of the biomimetic protocols that we published this year in 2017. Those protocols are the foundation of everything that biomimetic dentistry can do for a patient's dental health. We've identified 18 different areas that can affect the bond strength and longevity of a restoration. And those 18 different areas can make the difference between success long-term and shorter-term successes. We would like to have a restoration, if possible, to be permanent. If the function of the patient and the stresses on the tooth are too great and a fracture or any type of failure occurs, we want it to be a clinical failure, something that would be noticeable to the patient, but not a biologic failure which can be damaging to the tooth and the health of the pulp. So we are evaluating after 15 years the success of the different doctors that have been utilizing these 18 protocols, and we found a huge decrease of endodontically treated teeth. Pulps are not dying, and the failures are clinical failures but not biologic failures. If 1,000 restorations are done, there might be 3 after 10 years that have a fracture of the enamel replacement, and that can be replaced and repaired very easily. But I have one student, Dr. Bob Paxton, who I've known for since 1975, which is, I think, 42 years ago. We were undergraduate students at Brigham Young University, and over a decade ago he went through our training program for biomimetic dentistry. And he's restored very difficult teeth for most restorative situations. When you have a subgingival margin, that's the time when you're going to feel like there's going to be a shorter success of that restoration. But he's restored over 7,000 teeth who had deep subgingival decay. And in those 7,000 restorations, he has had no recurrent decay underneath the restoration done with the biomimetic protocols that he learned over 10 years ago. It's pretty amazing. In a normal practice, if you did 7,000 crowns over 10 years, the number of teeth that would be redecayed would be approaching 10%, 30% in some practices. And those teeth would have a percentage of pulp deaths. And those teeth, if they're treated endodontically, still have a ticking time where they might fail in the future. One clinical trial out of the East Coast, out of the Pearl Network, showed a 19% failure of root canals performed in less than 5 years. 20% failure in 5 years. You know, every time a root canal is performed, it might be good to inform a patient that that might be the outcome, because many of those retreatments on root canals can't be saved and the tooth is lost. And that was done in a setting of private practices. If you did the same number of teeth in a specialty practice, it would probably be better, higher quality. But still, if you could prevent endo, then you prevent the tooth loss from failed endodontic treatment. All of these concepts are very, very important. And as part of the Biomimetic Study Club, we want you to become familiar with all the ways that you can implement the protocols and have the same success like Dr. Bob Paxton has had over the last 10 years. And we'll be interviewing him and other dentists that have been trained in these protocols. We also want to make you aware that the basic training that we've been teaching for now over 15 years is now available on videotape. And so it won't be necessary to delay your beginning of your dental education and biomimetic protocols. You can subscribe to the videotapes and start your education in the comfort of your own home. And soon we'll let you know more about when these will be available. So until then, as we say, get bonded, and more importantly, stay bonded. This is Dr. David Alleman for the Biomimetic Study Club. Thank you.